Today we are going to be discussing the world of lobbying with Ms. Erica Sword. Erica is a registered lobbyist for the American Lung Association and has been advocating for public health on the Hill for 10 years. We're going to be looking at what an average day is like, what the process takes, and how she takes on big tobacco. So good morning, Erica. Thank you for joining us today. Let's begin with bringing us inside the Capitol building. What is the average day in the life of a lobbyist like?
Well, the average day doesn't always involve the Capitol. A lot of the times with the use of email and other work to make sure that constituents are communicating with their members of Congress, we're either on the Hill or back in our offices or in coalition meetings with partners.
Do you mind if we do a bit of a rapid fire question about what this actually entails?
Sure.
Okay, so what is at stake?
Tobacco is the leading cause of preventable death in the United States. Over 440,000 people a year die from tobacco use. And that translates to about 1,200 people a day. And so it's our goal to put into place public policies that work to reduce tobacco use. Tobacco is also a tremendous expense on our public health system and on our economy, totaling up to about $200 billion a year annually in healthcare costs and lost productivity.
And so what are particular provisions that you are usually trying to work on?
We certainly communicate about the importance of tobacco taxes, on helping smokers quit and putting into place policies that do so, and also making sure that the FDA, the U.S. Food and Drug Administration, has the authority it needs and the resources it needs to effectively oversee tobacco products.
What are you usually up against in terms of lobbying, like in terms of the political interests of the tobacco industry?
Well, I mean, their job is to continue to addict and sell their deadly product, and our job is to counter that.
And so what are some of the other big opponents that you face?
Well, the tobacco industry and other people who profit off of tobacco sales. There's certainly other interests that care about tobacco sales, and they're certainly vocal and very present on the Hill as well.
Do they include tobacco growing states?
It's hard to have a state advocate in that way. There are different interests that a state moves forward with. So there's certainly lawmakers from different states that have different priorities than we might hope for.
When you're dealing with such a big industry, how do you put together a team on your side?
Well, ultimately the American public is our team, and we know that people who have lost loved ones to tobacco use and people who are struggling to quit, people who have successfully quit, people who don't want their kids to start using are our most effective storytellers and our most effective advocates, and that's one of our jobs, to make sure that constituents are communicating that message to their members of Congress.
You worked on getting the Family Smoking Prevention and Tobacco Control Act of 2009 get put in place, which gave the Food and Drug Administration authority to regulate the manufacture, distribution, and marketing of tobacco products to protect public health, correct?
Yes.
That bill took over 10 years to become a law. What kind of effort went into that process?
A tremendous effort, and that it was really a long time in coming. The Lung Association worked for close to 20 years to ultimately get FDA to have that authority, but the efforts on the Hill were most pronounced for about 10 years. A tremendous amount of working with coalition partners, a tremendous amount of educating lawmakers, a tremendous amount of strategizing, a tremendous amount of working with our congressional champions and our administration champions on that.
So you mentioned coalition partners. Could you explain a little bit what that means?
Sure. We don't have the deep pockets of a tobacco industry or even the other corporate interests on Capitol Hill, and one of the ways that nonprofits especially work both to increase the echo chamber, but also to maximize everybody's expertise and skills and resources, is to work closely with partners. Ultimately, over 1,000 organizations endorsed the legislation.
So you had 1,000 organizations, you said, like working together to get this done, and I mean, you have the facts behind you. The evidence is clear. Tobacco and smoking cigarettes causes cancer. So why did it take so long?
There are a lot of different interests entrenched on the Hill. Hostile Congresses in past years have made it impossible to have the bill become law in 2004. So we continued to plug along and to bring along new supporters.
How do you deal with particularly like fence sitters, like people who are on the fence between both sides?
Generally educating people about what is in a bill, why it's important, and that there are a lot of people whose votes they want that are ultimately counting on them to do the right thing.
Do you ever communicate with the tobacco industry at all?
We do not speak to the tobacco industry.
How do you advertise for this cause?
We don't advertise.
Don't advertise.
We do not have a budget to do that, and so, but we certainly communicate, and there's a difference. So, that can be, emails, that can be tweets, that can be a whole host of different opportunities that we have to communicate directly to members of Congress. But what a lot of it involves is just old-fashioned pounding the marble floors in the House and Senate office buildings to talk with members and their staffs, and also to make sure that that our nationwide organizations that are back in home districts and home states are communicating the importance of the legislation that we're advocating for here.
If you could compare the type of money that goes into like the public health side of the campaign versus the tobacco industry, I know last year alone they spent over $26 million on lobbying.
Well, it's a different perspective and it's a different approach. We do everything we can with the resources we have, and ultimately more resources makes for an easier job.
So what did this act mean for Americans?
Well, it meant for the first time ever that there was a watchdog over the tobacco industry and the products that are being made to manipulate, to addict, and ultimately to kill them. And that is a tremendous impact on the public health. No longer do we have light and low cigarettes.
You said light and low cigarettes? What is that?
Light cigarettes were something that were introduced by the tobacco industry to try to assuage smokers that the products were less harmful to them. Much like a Diet Cola that is probably more dangerous to consumers than even a regular cola. Light and low tar cigarettes, mild cigarettes, ultra-light cigarettes were used to particularly target and addict women. And ultimately what happened was, instead of getting lung cancer in your upper lobes because you had to breathe more deeply, it ended up in your lower lobes.
Well, in this case, you had hard facts to support your cause. For example, every year tobacco kills more Americans than did World War II. More than AIDS, cocaine, heroin, alcohol, car accidents, homicides, and suicide combined. So, however, do you think all lobbyists have such hard facts to support their cause?
Well, facts don't always matter. A colleague of mine says that Congress governs by anecdote. And so one of the most important things that we can do is to have constituents share their personal stories. Facts only get you so far. Ultimately, personal stories go a long way with convincing someone to do the right thing from the public health perspective.
And so how do you reach out to constituents to get them to share their stories? Sometimes could be devastating stories.
Well, there are always devastating stories when they come to tobacco use. And that's one of the things about a nationwide organization that works to help smokers quit, that works to engage people in other ways, that if they're able to then turn around and share their stories about why it's so important that policy change occurs, then that helps.
And so how do you establish trust in Capitol Hill?
It's personal relationships. It's making sure that you do have the science with the facts behind you, that you're not being deceptive or disingenuous. We don't have the opportunity in working for a nonpartisan organization. We don't make campaign contributions. That's illegal for a nonprofit 501c3 to do. And so what we have to continue to do is to build relationships with Hill staff to become a trusted resource.
And so does that mean regularly keeping in contact with them?
Absolutely.
So even when a bill like this is not being worked on, just keeping up those relationships?
Absolutely.
What do you think the world without lobbying would look like?
Well, this is something that was protected and envisioned by the framers of our Constitution. I think that, unfortunately, lobbying can have a very negative connotation, but there is a difference between corporate lobbying and lobbying on behalf of the American public, and I think that's a differentiation that isn't always made.
Do you think that we can fix this sort of disconnection with the American public?
Well, it's important that no matter what you care about, whether it's public health, if it's clean water, if it's clean air, all of these different things, all of us have a responsibility to communicate what we care most about to the people that we send to Washington, to help communicate that there are a lot of people that, despite their very busy lives, are keeping their eye on the prize.
Right. Well, thank you so much.
Thank
Learned a
you.
lot today.
Thanks so much.